Hello, everyone. I'm really pleased to be with you all here today. I'm Lisa Marsh Ryerson, the president of AARP Foundation, and I'm so thrilled to be here with three terrific experts, panelists, and colleagues and friends of AARP as well. Before I begin, I want to give a shout out and a thank you to my really talented colleague, Stacy Alexander, Director of Thought Leadership and Outreach at AARP, who has helped us put today's conversation together. And as we begin, I want to join you or have you join me in recognizing and acknowledging the importance and the timeliness of this conversation about creating equity for all. This conversation is always important, and change and action have been needed for generations, and we have to move forward with change. But as we are witnessing, and for many experiencing such deep pain and anguish and anger over the horrific death of George Floyd and long-term systemic racial injustice in our nation, I think that the conversation today with these experts takes on new meaning for all of us toward action. Many of the inequalities and the disparities that we see in our society today do in fact stem from generations of systemic and institutionalized racism. The path forward, which we know is very long overdue, requires participation at all levels, from all sectors, and from all of us. And in fact, from my point of view, it means we have to move beyond studying the problem to focused action forward. As you may know, I hope you know, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and older to choose how they live as they age. With a nationwide presence and nearly 38 million members, AARP strengthens communities and advocates for what matters most to families: health security, financial security, and stability and personal fulfillment. And at AARP Foundation, we are the charitable affiliate, and our work is work to end senior poverty by helping vulnerable older adults build economic opportunity and social connections. We strive to address the inequities that vulnerable, underserved older adults face each and every day. And we also do this through our work with legal advocacy and litigation. We don't do our work alone. We collaborate with individuals and organizations who share our passion for solving complex problems, and often through social innovation. We also know that longevity, the fact that people are living longer, is in fact a disruptive trend. And while there are many positive stories to tell about increased longevity, the current coronavirus pandemic has also made many of our shortcomings and unresolved systemic issues crystal clear. The virus does not recognize race or religion or income. Yet in the United States, COVID-19 has disproportionately affected communities where historically there has been less opportunity and less access to equitable health care. United States Blacks and Latinx have been hospitalized and are dying at disproportionately higher rates. These disparities are not random. Instead, they are a result of a long history of inequity due to a lack of social, economic, and political opportunity. We believe that all people should have access to the resources, the services, and the supports that empower them to live a life of dignity, of good health, and of purpose, regardless of age, of race, or of income. So we need to recognize that large-scale intergenerational poverty belies this long-standing belief of the American dream, the national narrative that there is upward mobility for all. So how do we create change? Well, fortunately, I'm joined by three outstanding, really extraordinary experts today who are going to begin a conversation together to help us decide how we need to move forward in action. So to start, I want to ask my three panelists, our great colleagues here, if they would introduce themselves, and in your introduction or post-it, answer this first question. Longevity demands that we replace outdated models. What needed changes do you say? I'm going to start with Surya Kolluri, then move on to Dr. Dora Hughes, and finally on to Spencer Overton. Surya.
Lisa, thank you very much. Thank you very much for the invitation on behalf of Bank of America. I love the title of the summit, Social Innovation. I'm hoping as we go through this conversation, we can get to that social innovation part. But very quickly to introduce myself, I'm part of the retirement business at Bank of America. So you can imagine, therefore, we certainly think deep and hard about these longer lives that our clients are living and the public at large is experiencing. And because we're a financial institution, our focus has been thinking about the financial journey that we go through. And so my particular role is to do research in this area and share this research with our clients and the public at large, as I'm doing today. And what we have done is taken this longer life that our clients and the community at large is experiencing and divided it into life stages. And so we've looked at young adults, parents, caregivers, and then we've looked at some tough breaks sometimes we might have in our life journey, such as divorce or widowhood, and then retirement. And our most recent study that we did was on grandparenting, and then legacy planning. Now, why did we break it out into these life stages? Because we wanted to see what the financial implications are as people go through this journey. It's very difficult for people to look out 30, 40, 50 years and say, hey, here's how it's going to be. But the decisions we make today will impact how we help ourselves and our families deep into the future. And so by putting out these financial puzzle pieces on the table, people can say, aha, this is the impact we're going to have now, in the medium term and later. So let's make some rational choices at the kitchen table, with our accountants, with our advisors, et cetera. So that is the framing of how we think about this opportunity and how we can help our clients and the community at large navigate this. And as we go deeper into this conversation, I'm happy to touch upon some of the elements of these life stages. So Lisa, I'll turn it back to you.
Hi, my name is Dora Hughes, and I too want to start by thanking AARP for inviting me to participate on this important panel. And as always, I commend AARP on its thought leadership in health and certainly so many other areas. In terms of needed changes, as a doctor, I find it to be a bit awkward for me to be the one to say that an equitable path to healthy longevity, frankly, requires us to focus a lot less on healthcare and a lot more on health. And why do I say this? Medical care is estimated to contribute only 20% to healthy outcomes for a population. The other 80% reflects what we call social determinants of health. Social determinants of health is a relatively new term in healthcare. As defined by the World Health Organization, social determinants of health are the conditions in which people are born, grow, live, work, and age. These conditions are shaped by the distribution of money, power, and resources at global, national, and local levels. To break down this 80% a bit further, 30% of social determinants of health are health-related behaviors, such as smoking or drinking or exercise. 40% of social determinants of health are socioeconomic factors, such as income, job status, and educational levels, and community safety. And the final 10% are environmental factors, which include physical surroundings, such as your house. This pandemic and the recent killings of Black Americans graphically illustrate these points. Minorities are about 50% more likely to work in lower paid and frontline jobs, which increases their exposure to individuals infected with COVID-19. Minorities are also at higher risk for violence wherever they are, but especially in certain communities where there are risks to their physical safety, whether from racist, civilian vigilantes, or police brutality. We are seeing the healthcare system more and more beginning to work with public health and social service providers and others to address social determinants of health, whether that's focusing on food security or housing or transportation or all of the above. These are newer models, providing patients integrated care that can address all of their needs. And this represents a major paradigm shift for the medical community. But ultimately, to be truly successful, we have to move further upstream, and instead of focusing on the individual, we have to adopt a community perspective and address the root causes of health inequities at the systems and structure level. And by that, I mean, what are the laws or policies in place that lead to negative social determinants of health in the first place? As two examples, we can't tackle homelessness without addressing unaffordable housing. And we can't tackle obesity without addressing food deserts or areas without grocery stores. Equity in health and longevity implies that ideally everyone should have a fair opportunity to attain their full health potential. Or to say it in a different way, health equity is the absence of avoidable, unfair, or remediable differences among groups of people, whether defined by race, ethnicity, income, disability, or other demographics. To achieve equity in health and longevity, we must address both healthcare and social determinants of health. And that is my area of research as associate professor at George Washington in the Department of Health Policy. That has been my focus working in government and in the United States Senate and Department of Health and Human Services. So I'm very much looking forward to this conversation focusing on what we can do and across the sectors to improve health and longevity in an equitable fashion here today. Thank you very much, and I look forward to your questions.
Thank you, Dora, and thank you to my panel for knowing that though I was out of business there for a minute, I'm back and you kept it going. Spencer, we turn to you.
Thanks, Lisa. Appreciate it. And thanks so much to AARP. I am a proud member of AARP. The Joint Center is America's Black think tank. We've been around since 1970. We focus on the future of work in Black communities. We've also been doing a lot of work recently on COVID-19 and Black communities. You can find some more of our work at jointcenter.org. I know this is a difficult time for many of us. There is a tendency to kind of feel alone and unheard and tired and weary at some points. But it's also an opportunity to feel connected. Last night I went to a vigil at a local school. I kind of told my kids, we got to go to this. I thought there would be only a few people. I wanted to kind of give affirmation to those folks who weren't people of color who showed up. And I got there and basically there were just so many people. They were social distancing. But I was really inspired that so many of my neighbors showed up. In the neighborhood I live in, it's not a predominantly African-American neighborhood. And I thought I was going to affirm them, but it really turned out to be an affirmation for me. And so it was very meaningful, and it's just a difficult time. And you know, your thoughts, your engagement are appreciated, and we want to figure out how we can be engaged past the immediacy of this moment. Now, in terms of our topic today, this problem of the future of work traditionally, right? We've looked at places like Appalachia or the Black Rural South or the Mississippi Delta. We really see the same thing, basically industries that pop up. Eventually they become automated, whether it's agriculture or coal mining or using the Mississippi River as a waterway. And then the question is, how do we redeploy people? And too often we've kind of relied on markets, on, you know, the Great Migration in terms of Black folks moving or people moving out of coal country here. You know, right now we have to think about the future of work and be more affirmative in terms of how we redeploy people. The private sector doesn't necessarily want to pay to train a competitor's worker. local government doesn't want to, pay out money and see people just move away. There are questions about benefits. Should they be attached to an employer? People are working in jobs for a shorter period of time. And so do we need, portable benefits? And so, what does the social safety net need to be for people? Obviously, continuous training is an important part. Now, what I've just talked about has been kind of the traditional future of work discussion and debate. Now, COVID-19, we've seen some changes in terms of this new economy that is going to emerge. Some jobs are not coming back. COVID-19 has accelerated these issues in terms of economic issues. And there's been a particularly severe impact on people of color and older Americans.
Right.
We've seen a transparency of inequality with new technologies in terms of video, with George Floyd, as well as data that shows us the impacts of what's going on right now. So longevity and racial inclusion have to be a part of this new economy as we reset. And I look forward to talking more about what we need to do during our discussion today.
Yeah, thank you to all three of you. You've raised important topics already: financial decision-making over the life course and innovation, social determinants of health and root causality, workforce, what will work mean? And Spencer, as you're saying, the intersectionality of identity for individuals and how that plays in as well. So Dora, I wanna lead with a question for you. And before I do that, for all who are tuning in and participating today, use the portal app to input your questions, and we'll get to Q&A in about 20 minutes. Dora, I really was appreciative that you started from a public health perspective, giving your work and experience and talking about public health and social determinants and root causality. And I think everyone has heard that sadly or unfortunately, a zip code can determine so much about health as we age and longevity. So can you talk more about public health barriers? What are you seeing, especially during this COVID-19 pandemic, and how do we address those barriers to build more equitable access specifically to healthy longevity?
Thank you for that question, and you're absolutely right. In the public health world, we often say your zip code is more important than your genetic code in determining health outcomes. And pre-pandemic, we could point to a variety of conditions, I think. Infant mortality is a classic example where if you look at infant mortality in Mississippi, it's double the infant mortality rate in Massachusetts. And that would be true for diabetes and stroke and so many other chronic conditions. COVID has really helped to shine a light on geographic health disparities. Generally, residents in more densely populated urban areas have been more affected. Certainly with some exceptions, such as individuals working in meat processing plants in more rural areas. But we're really seeing, in stark terms, this disparities. And to disrupt this inequity, certainly first, we need to make sure we always have the data. Many in the public health community were caught flat-footed in terms of the response because of the lag and state and local data that was disaggregated by race and ethnicity and other important variables. Second, we need to be strategic when allocating resources, both during the response right now, but also moving forward during the recovery and rebuilding. Some communities will absolutely need more help, and we need to make sure that they have it. But we also, and back to this panel, I mean, we need to build back better, I think, as some have described it.
Right.
To think more innovatively, and what can we do, whether that's increasing use of community health workers to care for community members in the community, or as Spencer mentioned, leveraging telehealth or virtual health care to overcome access, or any other models. But I think, and to circle back around, perhaps most importantly, we need to acknowledge that health equity includes racial equity. And we need to much more systematically address implicit bias and discrimination and the mental and physical trauma of affected communities is part of our response. And so with that, I'll turn it back to you, but there is just so much that must be done in this area.
There's a lot to unpack in your response, Dora, so I hope others will jump in on that as well. Dora, you spoke about innovation, and also Spencer started us off, and Surya, around innovation and digital. So that's about digital divide issues. It's also about designing tools and resources with the user in mind. So if we're building from an equity framework, we start there when we think of the customer experience. And Surya, you spoke about that. So will you share with us, in terms of financial health, what you're seeing in the world of innovation and how innovation is being used to promote financial healthy longevity, and how those who are older can hedge their risk over time as well?
Absolutely, Lisa, thank you. I also wanted to make a quick connection, and I was dying to do this even as Dora was speaking in her original remarks, where Dora, you were talking about the importance of health and health equity. And I wanted to draw a line between that and the research that we did. As we were doing this research on these life journeys, we identified our research respondents as identifying 7 different life priorities. And those were, just to rattle them off: finance, family, health, home, work, leisure, and philanthropic giving. And then being the research analyst, I couldn't help but ask them to rank them. Say which of these priorities, stack rank them. And in hindsight, it is not a surprise, but at that point, it was a surprise that more than any of these life priorities, health was number 1, like by a mile. And the number 2 priority was family. And as a financier, I was getting anxious that money was not on the list, but finance was 3rd on the list.
Yeah.
And so we did a whole deep dive on the topic of health and retirement, and we learned a lot. So I just wanted to make that connection, Dora.
Sure.
The point that you were making, even as a banker, in our research, health is like, blaring red lights as a very important topic for our clients. So to answer Lisa's question, the way I would, the innovation framework I would share is to ask everybody to think about a triangle as we think about these longer lives. One of the legs of the triangle would be, of course, financial fitness, which is going through this journey and being pretty planned about how we incur expenses and trade-offs. The second one is physical fitness. And of course, in our culture, we have gotten quite cognizant about how we eat, blue zones and all these things. But one of the things I would add there is the importance of sleep and the amount of impact sleep has on brain health. So physical fitness is the second leg of the triangle. The third leg of the triangle is what we would call social fitness. And the moment Spencer talked about the evening out for a social cause, what was going on in my mind was that is an act of engaging in social fitness. And the research on social fitness is pretty dramatic. So for example, let's say somebody retires and has a membership in 2 different organizations. And if they maintain their membership in those 2 organizations, according to research, the risk of premature mortality is 2%. If they drop one of the 2 memberships, the risk of mortality is 5% premature. And if they drop both, it's 12%.
Sure.
Right?
Oh, yeah. Social isolation is a leading cause of early death.
Right. And so health and wealth, 2 sides of the same coin, is now understood. But I would now make it a triangle to say social equity is as important as financial equity and physical equity.
Yes. Thank you. Thank you so much, Surya. There's a lot to talk about. And Spencer, I want to turn to you because so much of your work is being brought up in these topics. And before I do, also thank you for the generosity of your sharing about your evening last night with your children and with your community. So thank you for that sharing. You know, COVID-19 has driven up our awareness of inequities, and you work in policy, and specifically in economic policy. So I want you to share with us, if you would, from your point of view, which economic policies or what should we be driving toward in order to address these deep inequities that are growing nationwide?
Right, Lisa, you know, there's some short-term priorities and longer-term priorities, and we'll get to them. It's important to understand where we are. And, you know, I think we've heard the numbers, but let me just reset so that we're all on the same page. as you all know, since COVID started, 40 million people in the US have filed for unemployment. That's about 25% of our nation's workforce. Nearly 27 million Americans could potentially lose their employer-based health insurance, right? African Americans and Latinos were already much more likely to lack health insurance than whites. We'll, see what the numbers are now. In just the last month, the unemployment for Black folks jumped basically 10 points. And so right now, less than half of African American adults are employed here. We've also seen older workers hit. An analysis by the Brookings Institution shows that nationally, 34% of workers who are 50 or older earn low hourly wages, and about 5 million workers who are 55 and older in retail positions, another million prepare and serve food. All these people are vulnerable to layoffs during COVID if they haven't already been laid off. Black businesses have also been hit. There's been a decline of about 40% between February and April. That's compared to about 17% of white businesses in terms of the drop. And also, some folks are not employees, they're independent contractors. The CARES Act contemplated support for independent contractors, but some states haven't paid unemployment assistance yet to independent contractors here. So when we talk about, we've got to talk about this immediate relief in terms of how do we help people through this time, but then also how do we help people prepare and transition into the new economy? And I think in particular, when we think about healthcare workers, they're particularly important. People like nursing assistants, personal care aides. These are people who are on the front line. About 60% of them are people of color. They have low wages, they have few benefits. They often have to choose between working and getting affected or not working and not getting paid. It's obviously an impossible choice. This job is kind of the future because the population is aging. This is a job that's difficult to automate, but the question is, can we provide career pathways for people to become medical technicians, nurses, nurse managers, et cetera, and actually make more than the $23,000, $24,000, $25,000. And again, this really comes down to long-term policies that are supportive in terms of moving people up career pathways.
And Spencer, as you're talking, you're right, it is. And all three of you have addressed this. We need long-term sustainable change, and we need to connect in those short or immediate term needs with midterm and long-term and keep the attention focused, right? On developing a policy-rich path forward that really engages all sectors. Spencer, where you were talking also, and Surya and Dora jump in, those unemployment numbers, in particular for older adults, as you addressed, and older adults of color, and for women, in fact, are startling. And then we think about women and families and their role, Dora, in health and in caregiving for families as well. Then I think, Surya, about innovation. How do we actually, from your perspectives, what are those next steps we need to take in plan building coupled with immediate action to really drive the use of an equity framework for inclusion in health, financial, and in work?
Yeah, I love this question about, how can we innovate, and especially for our audience who is thinking about innovating socially, maybe from an entrepreneurial perspective or a social entrepreneurial perspective. How might we think about that? And over the years, I've met many social entrepreneurs, and I've also been a judge on the design contest at Stanford University for aging products and services. So what I would say is let me give 4 categories first. As social entrepreneurs think about providing business opportunities in this longevity space. One is obviously products. The second is services. The third, I would not discount the importance of information. And then the fourth is a technology platform. And so there are ideas to be had in each one of these 4 buckets. So let me give one illustration each just to make the point, and then in our Q&A, we can get to more of it. So on the product side, one of the products that was taken by in the design contest I was mentioning was a very simple one, which was a tray, an eating tray, but for patients with dementia. Right? So it was color coded, it was simple, it had some shapes on it, very, very simple device, but effective for somebody who's dealing with cognitive issues. So that's an example. Of course, you can go from there to robotics, but as an example of things we can think about in the product space. In the services space, caregiving comes to mind. The ability, majority of the people, if they can help it, want to age in place at home. So can we provide various levels of caregiving services as a business opportunity? The third is information. In fact, we just put out a guide on this. If people suddenly have a caregiving issue at home or any other health issue, how do they navigate? Particularly in this environment where it's difficult to go out and navigate, where do you get this information? So
and also if you don't have insurance.
If you don't have insurance, then how do you avail of it? Is the third. And the fourth is a tech platform idea. Let's call it the Uberization, right? So you can imagine Uberization of caregiving, where a platform connects people who need care with people who are giving care. So when I think about the hundreds of ideas I've seen of social entrepreneurs, I can bucket in the longevity lens. With the longevity lens, you can put it into these 4 buckets, and there's a lot of energy and a lot of innovation that can be had by thinking about it this way.
I think that's terrific, and certainly in all of those buckets, and also in fintech. And again, the challenge is how do we pull together all of the energy and capital and desire to use social innovation to address problems while still ensuring that we're doing this through an equity lens, so that all of this innovation is ever more inclusive and doesn't leave more people behind. So I don't know, Spencer, if you want to jump in on that from an economic standpoint, and also Dora from a health standpoint, because
absolutely.
telehealth is growing.
Just to jump in here, this intersectionality, and you mentioned it a little bit before, Lisa.
Yes.
By the time people reach 65, we've got 6.5 decades of discrimination that is accumulated here.
Right.
When we talk about income and disparities in wages and what that means for wealth and savings, when we talk about preventative health care, when we talk about, insurance and the impact on preventative health care, as well as food deserts and the impacts that's had on health, stress that's associated, and then people have to deal with ageism. So if they want to kind of continue to work, right, they not only have to, deal with kind of racism that's out there, they've got to deal with ageism in terms of the employment situation. So as opposed to kind of this one size fits all social innovation model widget, understanding these context-specific issues and how do we build systems to deal with the unique experiences of significant parts of our population. Another big issue is the caregivers, right? So many people who are caregivers are working a paid job as well. How do we accommodate them as workers? How do we accommodate them as caregivers, especially when we talk about them wanting to get skills and upskilling and that, being critical in terms of moving forward. So I just wanted to flag this intersectionality piece and how it's connected to economic mobility and being conscious of it.
Yeah, I'm so glad that you did again, Spencer, because we cannot. Otherwise, we are at risk of using new tools, but not addressing the fundamental problems, right? And the hard work that it takes to build equity in communities. So who should get our energy, our thought, our capital in addressing? We know who. Dora, jump in from a health standpoint.
Yeah, absolutely. Although from the health standpoint, I do have to just start off and give a shout out to Surya, who is talking about physical fitness and the importance of sleep. And Spencer was talking about healthcare workers. And I'm like, clearly we're all speaking each other's language, which is great because that's exactly, frankly, where we see this going. As part of my opening remarks, I mentioned that we are in the medical community increasingly moving beyond the individual approach to a community level approach to address social determinants of health. And as Surya mentioned, actually social support services, family, that is a social determinants of health. In addition, of course, education, jobs. But one of the more innovative frameworks that we're really seeing accelerate is what we call accountable communities for health. And that's when you actually have these formal, more formal partnerships that span healthcare, public health, and social services, but also the business community. You have the investors community, whether that be community development financial institutions or employers or transportation providers that are formally coming together to think about how do we take on housing? How do we take on food? How do we take on employment? What are the policies and laws and regulations that we have to address upstream that will have a long-term sustainable benefit for communities? And there's so many notable examples. I mean, one of an excellent accountable community for health, one of these partnerships is based, the backbone organization is an area agency on aging out in Denver. Others we're seeing all types of organizations, and I would note that in addition, some of them are supported by foundations, but HHS, the Agency Centers for Medicare and Medicaid Services, CMS, has launched 2 massive demonstrations focusing on how do we create and sustain these partnerships that can address community health and individual health. So we're pretty excited about that model, and I think it's a way that really ties together all of the efforts mentioned by Spencer and Surya in a way that has tangible health and longevity benefit.
Yeah, I think your remarks are so important, Dora, and Spencer's and Surya's as well, because you're talking about the integration, right? We're addressing multiple social determinants of health, and we have to do this in an integrated way. I also very much appreciate your focus, and Spencer, you spoke about this as well, developing closed loop systems. So it becomes our job to be sure that there are the right partnerships, but that we are navigating together to generate the results that we intend to generate in communities. So let me ask, questions are coming into the portal now, so I want to get to a few. And anyone can really take this on. But as Dora and others have talked about social determinants of health, what about education? So when we think about public health needs and we think about how foundational education and access to education is, talk about policy change. It certainly is important as it relates to work, Spencer.
So education is obviously incredibly important in terms of us investing in human capital. One of the problems we did a study on the Black rural South, and one of the problems we found was this notion of let's just sell cheap labor, whether that's enslaved labor to produce cotton, or whether that's sharecroppers that are cheap, or even later on when it's come here because our wages are low and you don't have to pay taxes. We're not going to invest in these people. And so we really need to invest in human beings and people. Now, that's partially pre-K through 12. That's important. We're all for that. Yes, yes, yes.
Yes.
But it's not just that. We can't just write off people who are older than 18 or 19 here, and really investing in a workforce that needs to be continuously skilled, and ensuring that we have a larger percentage of adults who have a high quality degree, certificate, credential, that kind of thing. And part of this is the private sector saying, what are our needs? And let's be honest with employees. and not just investing in equipment, but investing in terms of people here, right? But it also involves this dose of reality where it's not just education or not just skills. In other words, we've got to support people so they can get skills, right? So if they're caring for a parent, right, and they work all day and then they're caring for a parent, how do we get them support so the parent can be cared for while they acquire skills? You know, ageism and racism are real. So even if someone has skills, there can still be ageism and racism out there. And we need to teach managers how to manage people from all backgrounds and appreciate the skills that they bring to the table, as opposed to, you know, not retaining people who are skilled because of a cultural mismatch.
Yes, I mean, you're raising such important questions, you all are, right? Because this is about education truly being lifetime. I mean, no longer can we assume we have one credential and it lasts for a lifetime. But then we have to roll that back too, which is how do we always ensure that education, foundational education, physical education, health education is available to all. So we've had many questions from participants who are looking at this from a shared value lens or maybe from a corporate social responsibility lens. What do we say to them about how they engage with these issues effectively because they want to invest in more equitable outcomes? Dora or Surya, do you want to jump in on that first?
I mean, sure. I certainly, again, on the medical side, we are increasingly partnering with educational providers. I thought it was a great example. At Columbia University Medical Center, they are engaged with schools in terms of how do we improve pediatric outcomes. And I thought it was notable that one of the health metrics that they are evaluating is third grade reading levels. And I thought 5 years ago, 10 years ago, when would you ever have seen doctors using as one of their own evaluation metrics, third grade reading levels? And I think there's a number of examples about how you're seeing this intersection. And I do think, it is the partnerships when we're thinking about doctors working with school providers, thinking about school nurses and others that can provide schools or co-locating clinics actually in schools, to even thinking more broadly about health and wellness campaigns in the community focusing on providers and children. So absolutely, I agree with that question. And I do think it's very encouraging that we're seeing more integration between these two worlds.
Lisa, I want to jump in. Have a whole bunch of energy on the topic of financial literacy and corporate social responsibility. So I'll bring those two together.
Wonderful.
It's rather shocking if you all think about high schools and the curriculum in the high school and the lack of financial literacy in high schools. I spent in the town of Brookline when my son was going to high school, would go there and do financial literacy classes. Just, basic things like compounding, inflation. People coming out of high schools not having those concepts is a real detriment, number one. And so, and even what we've learned is in my business, even if you did coaching, even if you did a fantastic job teaching people about literacy concepts, it still may not lead to action. And in the retirement business, for example, when a young adult joins and they participate in a 403B plan, in Dora's case, or a 401k plan, in my case, we could not get people to save money for their own retirement and even get free money, which would be matching money from the company. Until the industry used a behavioral finance technique to make it an opt-out as opposed to an opt-in that made the savings rate much better. So that's just one thought. And the final thought I just want to close on the CSR side is at Bank of America, we have a program called Better Money Habits.
Yes.
Which is in the public domain that we have done in partnership with the Khan Academy to communicate some of these financial literacy concepts.
Right.
And Lisa, just building on
after Spencer.
I think Surya just makes a great point in terms of us paying attention to, behavioral economics, right? So as opposed to just saying, oh, these folks are illiterate if they just learn financial literacy, or they just don't have the skills. If they had the skills, we've got all these jobs. how do we design systems that result in the outcomes that we want? Not in a way that, you know, takes away all choice, but in a way where we design systems in line with the way we know most people behave, so that we get the outcomes that we want and the social outcomes that we want.
I think that's so important. It's like designed with the result, the end result in mind from the beginning, as instead of candidly driving into assumptions that keep people behind and down, which is what occurs. Dora.
So I just wanted to, you mentioned how can CSR participate, and I will have to say, in terms of many of the multi-sector partnerships that we're seeing, we are seeing CDFIs such as LISC, the Local Initiative Support Corporation, really invest in housing, and along with hospitals. We are seeing participants in wellness funds, particularly out in California, where again it's these commercial and investors and bankers that are helping to support health and housing and educational initiatives. We are seeing examples of people thinking about social impact bonds and how can we further deploy these models. So I think in terms of the actual financial underpinnings of many of these multi-sector partnerships is a critical role for the commercial and private sector to play already right now, but certainly even more moving forward.
Yeah, I think you're right. And it is, I mean, we cannot lose the opportunity in this moment, right? Which is the growing awareness that it is good for business to be much more equity-based and inclusive. So what's good for everyone is good for the business outcomes as well, just as it is true about age, right? AARP and my colleagues have done such important research that multi-generational workforces really are important when you're thinking about bottom line, and you're all talking about innovation as being inclusive too. Dora, before we move on to my last lightning round for all of you, I was so pleased that you brought up third grade reading levels, because AARP Foundation Experience Corps is all about that. We are using older adult volunteers in underserved communities to help children read on grade level, read to learn by the time they enter fourth grade. No surprise, it fights poverty over time. It helps children succeed. It's also really good for the older adults and for their health and connection as well, because sadly in our nation, we make decisions such as prison size based on literacy levels in early age. So lots for us to address. So now, and I'm going to start with you, Spencer, then move to Surya and end with Dora. What game changers could drastically shrink the equity gap in the next 10 years?
Yes. So, you know, there are a lot. There's not just one piece. Certainly this concept of social innovation, that innovation is not necessary just in markets, but in social change is important. So I'm just excited to be here. This concept also of shifting from an immediate response to COVID, an immediate response to social unrest, to the long term in terms of investments and how do we restructure our society. So that's important. Another piece is data. When we talk about whether it's reporting in terms of COVID-19 deaths or other deaths, disaggregated by race, disaggregated by age, we want to see what's going on. It's kind of like the videotape that records the police incident. We need to see what's going on, and data can help us with that.
Evidence matters, Spencer, you're right.
It does, so we can all see it and it's in front of us as opposed to arguing over the facts. And a racial equity lens in workforce development and in aging services and supports, that's also important as we look at policy. And then finally, additional government funding for long-term care workers, their training, their support. When we talk about benefits like paid leave, childcare, transportation, all of those issues, supporting that workforce so it is valued. They play an incredibly important role for all of us, really lifting those people up.
Great, thank you. Surya, your lightning round.
Yeah, Lisa, in the lightning round, I'd like to mention a mega trend and a social innovation idea that connects to that mega trend. And for me, it is the intergenerational workforce that we're going to have going deep into the 21st century. I'm not talking about 3 generations. I'm talking about 4 generations, maybe even 5 in the workplace. And so as managers, as owners of companies, as people who are managing the workplace, how do you make an intergenerational workforce be effective? So that's a megatrend that we're all going to be faced with. So the social innovation idea is, to my framework, can we create products, services, information, tech platform to make these intergenerational teams be very effective as we go into the 21st century?
Mm-hmm. Fabulous. Dora.
Well, the dangers of going last is, of course, you're like, yes, and absolutely, yes, but I think alluding to the comments, the game changer for us on the health side is really this population health focus, where again, you are aligning yourself very closely with the public health and social service sectors. But on top of that, I would also say it's critically important to really adopt the community focus, to really work in partnership, to develop the trusted and meaningful relationships. Not just asking for community input, but actually letting community be in the driver's seat. That is very hard work to get to that place, but ultimately I think that will allow us to be even more successful in the long term.
Terrific. Well, it's time to wrap up, and I don't want to, is what I would share with all of you. So for all of the participants, thank you for all of your questions. We could not get to all of them. I know you join me in a huge thank you to Surya, to Spencer, to Dora. It is very, very clear that as long as we have the will, there is enough information, there are levers to push across health and wealth and finances for a future that is equity-based and inclusive of all, that provides the longevity opportunity for all of us here in our nation. I have to say that I came into our conversation excited to be with you, but I think like many with a spirit that was tired. And Spencer, you spoke about that, the weariness of Black Americans and the anguish and pain that we all share. I am leaving this conversation knowing that you and your colleagues at your organizations and leaders across this nation, if we come together and use all of those tools, innovation, policy, healthcare access, and equity, we can build better and stronger, Dora, which are the words that you used during the conversation. So huge thank you to Surya, to Spencer, and to Dora. Thank you to my colleagues at AARP. Let's keep this conversation going. Let's keep the investments in the equity framework for longevity going as well. Have a great day, everyone.
Thank you.
Thank you.
Thank you so much.
Bye.
Thank you.